Hi, my name's Aneirin Rockwell, and I am an upcoming junior at Prattville High School in Alabama, United States. Today, I will be giving a presentation on the British charity, the Metta Foundation, and the work I have done with them to further accessibility to prosthetics in Sri Lanka. I would like to thank Johns Hopkins University and their Global Health Leaders Conference faculty for giving me the opportunity to present on such a pressing matter that I'm very passionate about. And so, let's get on. A little about me. For starters, I would like to give a bit of background on myself. My name is Aneirin Rockwell, and I live in Prattville, Alabama. I have worked for the Metta Foundation for about almost 2 years now, and in that time, we have made a large impact, which will be discussed later in this presentation. This year, I founded Metta America, which works directly with Metta Foundation with a goal to find sponsors for the patients in need. I enjoy spending my times on my hobbies, those being classical guitar, piano, soccer, cross country, speech and debate, volunteering in my city. While working with the Metta Foundation, I decided to spread the word of their work through my speech and debate team, and I actually ended up placing third in the state for informational speaking. My speech discussed the history, innovations of prosthetics, as well as some of the work Metta Foundation has done. So, moving on to the main topics of the presentation, we'll start with the table of contents, starting with the issue, then the solutions, the Metta Foundation's solutions, history of the Metta Foundation, their impact, my time with the Metta Foundation, how you can help, and lastly, conclusion and closing statements. Let's start with the issue. In developing countries such as Sri Lanka, it can become difficult for citizens to acquire effective medical attention. Though they have access to free healthcare, it's not very as effective when compared to privately owned healthcare centers. This makes it difficult for people to receive the devices such as prosthetics. According to a grant proposal written by Dr. Tina Reuter and Dr. Panagamua, there is about 160,000 amputees in Sri Lanka. Most of the amputations occurred from traffic accidents, work accidents, birth, diseases like diabetes, and lastly, the Sri Lankan Civil War. Finding prosthetics is difficult in South Asia, so it's difficult for amputees to receive prosthetics since there is a very high demand, but a very low supply. That's where the Metta Foundation makes its impact. There are many solutions towards this issue, and they're quite often highly effective, but there are several flaws with these solutions when it comes to regards in its use in places such as Sri Lanka. One flaw being cost. As to be expected, cost is quite important. For now, we will use Open Bionics Hero Arm, as pictured on the right, as an example. The Hero Arm is a very effective piece of technology, and it's a revolutionary device packed with a ton of technology and a stylish look to it. This arm allows the user to control each individual joint in the finger by sensing electrical signals in the user's muscle and translating these signals into movement. And the price is decently reasonable for someone living in a first world country. But that's where it can become difficult for Sri Lankan citizens. As some of you may know, Sri Lanka is not in the best economic situation as of 2022. And currently, $1 is equal to 360 Sri Lankan rupees, which makes it very difficult for them to even get their hands on a device like this. The Hero Arm and several other high-end prosthetics require a battery to operate, and in rural parts of Sri Lanka, electricity is not always available to everyone. Also, the country has power surges, which can really mess up electronic devices. One other flaw with these devices is they set a very high standard for charities like the Metta Foundation to try and fit into. The best available solutions in Sri Lanka come from the Metta Foundation. These solutions are highly effective for the location and don't cost anything for the patient. The Metta Foundation purchases used and discarded prosthetics from Western countries such as the United States and United Kingdom and reshape these pieces to fit the needs of their patients. The foundation is able to purchase these prosthetics through people such as you or me sponsor. The same general process is used for obtaining treatments. The Metta Foundation is completely nonprofit and directs all of its money towards the salary of its employees and the finances to purchase such devices for the patients. In places like Sri Lanka, it can be difficult for patients to make it to these clinics for fittings and casting. And especially with the gas crisis right now, this makes it all more difficult for people to get to the clinics. But that's where the mobile outreach service comes into play, as also pictured on our right. The bus is fitted with all the technologies needed to perform all these services that the clinic can. This allows for more patients to have access to prosthetics and treatments. The foundation also abstains from patenting their devices in order to allow people around the world to use their treatments in large circles of influence. Meta Foundation also recycles its parts, leaving a very clean carbon footprint. The Metta Foundation was founded in 1994 by Sri Lankan who moved to England, Dr. Panagamua, with the purpose of helping amputees around Sri Lanka. Metta, which is a word from the Pali language, translates roughly to positive energy and kindness to others. This name perfectly fits the goals and achievements of the Metta Foundation over the past years. The Metta Foundation helps those from both sides of the Sri Lankan Civil War and only seek to help those in need and do not discriminate from anyone seeking help. With this moral instilled into the charity, they have helped thousands since its founding. Here on the left, we have Dr. Panagamua, who I've been working closely with over the course of my time with Metta. He's the lead doctor and founder of the Metta Foundation, and I was fortunate enough to get to meet him in person this summer while visiting Sri Lanka. As stated, the Metta Foundation has helped thousands of people over the years, no matter what their situation. They've made several innovations, such as being able to reuse plastic of Paris and their own custom ankle and knee joint out of locally sourced parts. The patients are able to get these prosthetics free of charge and have the device made and installed whenever they needed. On the right, we have one of the patients I've been able to help. All photos that are shown of the patients will have their faces covered, protecting their identity. Here's my time with the Metta Foundation. As I stated, I've been with the Metta Foundation for about 2 years now. And in that time, I have connected with the Sri Lankan diaspora here in the United States. We have been able to get 20 children walking again and give them the childhood every child deserves to have. In the picture on the left, I was able to visit the Maro clinic this summer and drop off school supplies to some of the children who received treatment there. I also started my own charity, Metta America, which works directly alongside Metta Foundation, such as sponsors in the States who would be willing to donate. On the right, you can see the Maro clinic, which is actually a refurbished Victorian house from the time the British were there. This next slide is a collage of a few of our patients. And although you can't see their faces in the original photos, you can see how happy they are. The prosthetics give them an opportunity to face challenges of life with a head-on determination. It gives them a part of themselves that they deserve to have. And now how you can help. If you're interested in helping any way, there's several ways possible. You can donate at the Metta website, which you can find just by searching Metta Foundation. You could spread the word of what the Metta Foundation is doing, and even help in the advancements of prosthetics by going into fields such as biomedical engineering. If you have any questions at all, you can email me at aneirin.rockwell@gmail.com. You can message me on Instagram at Aneirin_Rockwell, or you can find me on LinkedIn as Aneirin Rockwell. The work the Metta Foundation has done has made such a large impact on the lives of those who went to them for help, and their name truly fits what they do. I would once again like to thank the Johns Hopkins Global Health Conference Leaders faculty for giving me this opportunity, and I'd also like to thank the Metta Foundation for allowing me to work with them so closely. Lastly, I'd like to thank our sponsors for their generosity, and I'd like to thank my parents for supporting my work and getting me to visit Maro in Sri Lanka. Thank you all for listening and have a wonderful day. Thank you.